apart from CT and myself, we have Dr. Mohamed. I mean, hii jina yake ya kwanza niseme, but I don't want to try. Muhyidin. Did I say it correctly, Dr.?
It's pronounced Dr. Muhyidin Mohamed.
Okay. I'll stick to Dr. Mohamed.
No, Baba.
No. See, he's Dr. Mohamed at the end of the day.
Baba, ongeza capacity kidogo. Dr.
Muhyidin
Mohamed. They will kill you.
Mbona mnanisumbua? See, I'm the host.
Yes.
Let me host.
Yes, we actually letting you host better.
So, Dr. Mohamed, how are you doing this morning?
I am very well. How are you guys doing?
We're well.
We're well.
You're a aesthetic and rejuvenative medicine specialist.
Yes.
Maybe you can let us know what that is.
Basically, would you guys mind a backstory to it?
Sure, why not?
Backstory is absolutely important for explaining this. Please.
So, the curiosity behind me moving into this field, which is a relatively quite a new field right now, especially in Kenya, is having worked previously in ICU.
Just stop from it. You are a medical doctor.
Yes.
All right, fine. You are a medical doctor. Now,
he's an MD.
Continue with the background.
Now,
ICU.
After training, doing all of that, moving into being placed in an ICU position, you end up seeing majority of very sick patients.
Yes.
And the biggest telltale sign that you first pick whether this person is going to end up in ICU or not is the things that you notice from their skin.
Okay.
And nails.
You can just I walk into the hospital and you can tell this person might end up being in the ICU.
Yeah.
Just by looking at my nails, my skin.
Yes, correct. And why am I picking out on this too? This is one, ideally, the temperature changes. Unasikianga mwili baridi. There's something wrong there.
Okay.
True. The other second thing is the nails. The nails tend to be, there's a way you have perfusion on your nails. You press it like this, it becomes white. You leave it, it becomes red.
Please press mine.
You press it like that.
Yeah.
It becomes white. You relieve, it becomes red. And you have a number of seconds. Ideally, should be less than 2 seconds before you have this back.
Okay. Am I okay, Doctor? Please proceed.
Scare him a little bit.
Yeah.
Tell him you need further examination before you can actually determine whether he's actually well or not.
So, sir, the reason why I looked at that and saw that the first part of our body that dies naturally before we have the internal organs collapsing is basically our skin, hair, and nails. And even in the aging process, before our kidneys age, before our liver ages and it's not able to function, before the heart ages, the first place that gets hit most is the skin.
Okay.
And now it inspired me to look at the different avenues that we can have in order to prevent or even slow down that aging process. And that is my answer into going into aesthetics and rejuvenative medicine. So you're trying to basically maintain your cells to not have hit a specific age group despite them having reached that specific age group.
Okay.
So you're basically slowing it down.
So what I'm getting from you is that people probably CT's age. Okay, people who are,
No, please just go on. I do not have a problem with you mentioning my age, which you actually don't know.
So people who look like my colleague here, or who
are as old as CT. Please go on.
So
yes.
People CT's age, when you press their fingers, will their knees react the same way?
Yes.
So it should
react the same way.
So it doesn't. So if you're old and you still have that issue, then that means there's a problem.
Okay.
Not necessarily.
Not necessarily.
Okay.
Before we get to the nail thing,
I'm gonna go home and press my father, my mother, my everyone.
Before we get to the nail thing, there's a significant difference, and the reason why I use the nail is where we're talking about perfusion, blood.
Okay.
Right. So whenever you see the nail thing and it's delayed to a specific more than 3 seconds, 4 seconds, there we have a significant concern.
Regardless of your age.
Whether you're 1 month or 1 day old to whether you're 150 years old, if there exists someone at that age, it's now an emergency.
Okay.
But looking at all the other aspects, number one, the character of your skin, to the complexion, to the visible sun damage, to the static lines, the wrinkles that we see, all of that points out to, if we had done something, if we had used certain elements in your body which are naturally occurring, we could have progressively delayed this. Big one giveaway I'd mention is something like collagen. Collagen production in the human body starts stopping at the age of 30 and above.
All right. So for someone who is hearing collagen for the first time, what is collagen?
So collagen is a naturally occurring, let's say, tissue, which is supposed to hold for us the structure between the skin,
the muscle,
the fat, and the muscle, and even within the joints. Okay. So it's basically a connective tissue. It tries to hold the cells together, right? So as we age, this collagen starts not being synthesized or being produced enough by the body.
Okay.
And dietary modifications as we age also affects this. So if you find someone is always on carbs and, let's say, vegetables, collagen is mostly found in things like bone broth. Mafuta, not mafuta. Ito nini, supu ya nyama. The cartilages that you...
Supu ya mfupa.
Yes. The cartilages that people eat from chicken, unaona ile ukipata drumstick ile kitu ngumu imeshikilia, that's very rich in collagen. So moving from point A, where you've now reached 30, okay, to now trying to maintain the integrity of your skin, joints, and even hair, it is now essential to look at supplementation of such collagen in order to maintain your cells and your skin to look fairly younger than another individual who is not.
Doctor, are you saying that now I need to start taking collagen supplements?
There's no issue if you don't. The earlier the better.
You've been told drumstick.
Yeah.
That bit that is a bit chewy at the end.
Yes.
Rich in collagen.
Do you know I chew that thing like nobody's business?
What natural things do you need to consume which are rich in collagen?
Okay.
That's what you need to ask instead of going to supplements.
All right. So, umesema ya kwanza bone soup.
Yep.
Ya ng'ombe, ya mbuzi, ya kuku?
Any.
Okay.
Even the other interesting part is samaki. It's quite marine animals. They're very rich in
collagen. So fish, omena.
Yeah.
Pweza.
Omena is fish, chief. I know it's small, but it's fish.
Can you just let me host? Can I just host?
No.
So omena, tilapia.
Now that is good. Yes, like that. Yes.
Okay. Now, getting back to some of the issues that we might have, who are the kinds of patients who come and see you?
Ideally, we're talking about majority are women, and some of them are men. Men come in with issues of hair concerns and
hair loss. CT will never be your patient.
Is rocking your look. For men, it's basically maneno ya nywele. Occasionally, I do find men come in with issues of hyperpigmentation.
What is hyperpigmentation?
Hyperpigmentation is a localized, patchy area where you find that there is excess melanin, the pigment that defines our skin color, in comparison to any other body surface area.
How does this manifest?
Hyperpigmentation.
Yes, I mean, if you look at me, will I look like a leopard or a giraffe?
I can see sunspots.
Yes.
That's one. Two, hyperpigmentation is predominantly found on areas where the sun strikes. And in some individuals, because of medical conditions, again, you might find that they have localized hyperpigmentation. This is a specific area where the melanin pigment is concentrated more a good example, I don't know how to define this into plain language. There's something called acanthosis nigricans, where you find it more common in individuals who are obese, pre-diabetic, high cholesterol, overweight
So what
kind
is-
of class.
Yeah.
So the acanthosis nigricans is where you find there's a dark skin lying on top, especially on intricate areas.
So
Of
armpits, groin.
the back of your neck. I don't know if you've ever seen this.
Come again.
You
ati-
must have had friends who you look at their back, unaona kuna wrinkles hapa, alafu kitu ya black imelalia juu.
It's like a black patch, a
Yes.
patch that has a dark brown patch that has somebody has smeared in that area.
Yep.
I don't. Perhaps I have seen. I don't know. Perhaps I have. I don't know.
That's another form of hyperpigmentation, but now we look at it from a metabolic aspect rather than just skin, because the reason why it came, it's more tied to an individual's body fat composition. Yeah,
So is it a good or a bad thing when it appears?
it's not a good thing.
Oh dear.
Yeah.
And how bad is it bad?
Okay. Do you want us to go into the
Yes,
complications?
I do want to go into the complications so that one understands that when you see this, this is exactly what it is that you are likely to face. Not you will face, but likely. Yes.
All right. So that's your skin telling you, boss, amka, you need to do something, right? So before we even get there, there must have been these other characters that have been passed. One, a BMI index of more than 30. Someone is obese, overweight, morbidly obese. Ukienda hospitali unaambiwa your BP is always misbehaving. So you already have one, high blood pressure. Kidogo kidogo unasikia, I feel like peeing all the time. Yeah? I feel like peeing all the time. I'm thirsty all the time. I want to eat a lot. So you find that your sugar control is also out of the picture. You also do your cholesterol levels. Unaambia boss, and there's a lot of fat in your circulating within your blood, and this fat can find itself and attaching to the blood vessels.
Yeah. So the arteries, the capillaries.
Yes. So once the arteries become involved, and this what's it called, fat deposits itself on these vessels, you are away from two possible consequences. One, stroke. Two, heart attack.
I feel targeted in this conversation.
Not really. What is the difference between a stroke and a heart attack?
So basically, a stroke is where you have either possibly two things. A stroke can come from bleeding within the brain, all right? Or it can come from insufficient blood supply to the brain.
Stroke.
Yes.
What causes bleeding in the brain?
Bleeding in the brain can come in from a number of various factors. One
Quite
is
aside from being hit on the head. Yes.
that's trauma. Two is we have individuals who have been put on medication, things like blood thinners, and now they get like a minor fall or something. You understand? And then you have individuals who are born with something called an aneurysm. So an aneurysm is where you have like abnormal expansion of one of the arteries within the brain. You've taken me back to ICU again.
Yes, we have. Please go on.
There's a lady I saw. She was from a wedding, and this was around 5 years ago. She was from a wedding. Ameletwa hospitali. Everything looks good except her blood pressure. And the headache that she has is
Crazy.
Profound.
crazy.
Mm.
You're giving drugs, painkillers, compare 2 minutes, imerudi. And it's not like the headache where you'll just be somewhere relaxed. She's writhling. Naona mtu
She's in excruciating pain.
Yes. Only difference is we notice is she's using her left side of her body to
Communicate.
communicate. The right is immobile. Immediate angiogram we order. We see one of the arteries, which is called a Berry's aneurysm, to have snapped. And the trigger behind it was iyo kelele in the wedding hall.
So it burst that.
Yes. So the good thing is we managed to include the neurosurgical team. They did something called coiling, and she's fine now.
Okay.
Yeah.
So a stroke can be corrected and never happen again, depending on what caused it.
We have a specific time set. Much as I'm not into this field now, there's a specific time set that we work in. Ideally, any stroke case should be attended to within maximum nambali 2 hours. If you want to salvage an individual's prevent that physical disability to come in, it should be salvaged within 2 hours. You must have a plan within 2 hours. A heart attack, you must have a plan within less than 90 minutes.
So again, describe for CT, because we've tumeongea juu ya stroke. Yengine ulikuwa muuliza ni cardiac arrest. Or was it
heart attack?
Heart attack, okay.
What is it?
So a heart attack is basically same principle, where you have insufficient blood that is supposed to carry the oxygen to go to the heart muscle. The heart muscle's function is to pump it. So if we are not getting blood to the main thing that's pumping
it's
pumping it. Well, how much time do we have? Very little. Characteristic features of it is having that acute onset, very short time, chest pain, either centrally, and the pain is characterized as nikama someone is squeezing you, okay?
From the inside.
From the inside. It's either squeezing, choking, rarely sharp. It moves all the way to
shoulder,
to your left shoulder. It is not defined that every person who comes in with a right shoulder pain and this pain should be told, okay, that's another thing. You have to look at the heart. Because if not addressed in a specific time set, this person is going to go.
Yeah. It's a problem.
And this going here means you will leave this world?
Potentially.
Okay.
Potentially.
Well, okay. I didn't think we'd ever have a horror movie on this breakfast show, but we've just had a very horrific conversation. Now, let's get back to aesthetics and aesthetic and rejuvenative medicine. You've said patients who come to see you, mostly women. So what are some of the, there's something you've said, and now I feel like you're giving us, what is free consultation? Are these the things that you were talking about underneath my eyes? Yeah, so those are the sunspots. Yeah, what brings them about?
So basically, ideally, for the sunspots to occur, you have tiny lipid droplets on top of your face. Now, the lipid aspect of it, when it's hit by the sun, causes oxidization.
Okay.
Together with the environmental exposure, causes oxidization, and that leaves like a dark
spot.
All
right. Similar to what we are seeing on CT as well over here. So are they something that you treat? Are they treatable?
Yes.
All right. And
very much.
So I can get rid of them?
Yes.
Completely?
One is adequate sunscreen use. Two is...
But I'm rarely out in the sun. But anyway, continue.
Sunscreen use. The other second most important point is, if I'm going to tell you use sunscreen, okay, and we are individuals of black skin, we naturally do not synthesize enough vitamin D because of the pigment in our body. Yes. So if I tell you block yourself from the sun, I want you to take a certain level of vitamin D, so that, because vitamin D is needed for your enzymes, it's needed for your muscles, it's needed for your bones, it's needed for your cognitive function. So there's a lot you'll miss out on if you're not taking that vitamin D and you're always on sunscreen. Yep.
So, and I'm asking now this for my sake, and perhaps someone else will look at me and be like, okay, so that's what the guy is talking about. So you're saying that I need to start taking vitamin D supplements. Is that what I'm hearing?
No.
Okay.
Number one.
Yes.
If there is no symptomatology of vitamin D deficiency, you can check. You have to, as black people, we have to routinely check and screen for the vitamin D levels in our body. All right?
How do you do this?
This is a blood sample.
Okay.
It's a blood sample inapelekwa lab, inapimo, unaambiwa your vitamin D is between this. Is this value? The normal range is between 30 to 100. So if you're anywhere below 30, after
Supplements.
If you're even below 10, we need a better dose.
I need IV now.
Yeah, no, not IV. we need stronger doses to come in. Yeah.
Okay.
Now, concept is, if you are on sunscreen as a black person, it's essential that you unatumia vitamin D, and this is why I say this. The role of melanin is to, number one, absorb and reduce the effects of the UVA and the UVB. Okay?
This is the ultraviolet A
Yes.
and ultraviolet B.
From where? The sun.
Okay. So there's a UVA and UVB.
Yes. These are rays that are naturally just coming in from the sun. They're everywhere. Every organism on Earth will
receive them.
receive it.
Okay, as long as it's sunlight.
As long as there is sunlight.
Okay.
Now, the difference is the concentration of these rays that is coming to hit the Earth is not equivalent on the entire surface of the Earth. So the sun rays will hit the area along the equator.
Yes.
More concentrated. Those rays will be more concentrated than in the northern hemispheres and the southern aspects of the hemispheres, respectively. So you find that this UVA and UVB is one of the things that triggered people within the equatorial areas to have a more melanated skin.
Hence Kenyans.
Sudan, go to South America, anywhere along just the equator, you'll find coming when where is it, New Zealand, just above Kidogo, you find that these people are still melanated, and that's because of the adaptation that they had to undergo from the sun. Why am I saying vitamin D is important now? If we are already having enough melanin, right? And the melanin is supposed to absorb and try to counter the damage of this UVA and UVB.
Yes.
Remember, vitamin D is supposed to be formed or triggered by these rays hitting our body. And our body is already pushing it away and telling it, we are more melanated so that we can resist your effects.
Yeah.
So we tend to form minimal vitamin D from our skin because our skin is just trying to protect block it, those rays. So apply sunscreen on top.
So now you've blocked it completely.
Yes.
Okay.
So you now have to think of supplementation.
Okay.
Yeah.
All right. I mean, it makes sense. Now, for the patients, again, going back to your patients, the patients who come and see you, we've seen now they have skin issues and nail issues. What are some of the nail issues that you diagnose, and even hair problems? What do you diagnose, and how do you treat that diagnosis?
Okay, that's a very open question.
Yeah.
I would say the biggest concerns I see in the context of nails, not as much. The biggest problems that maybe see is infections, something called paronychia, because unasikia ile kucha imeingia ndani, an ingrown nail, which becomes bacterially infected, so you now have to do a minor surgery.
Yeah.
You have fungal nail infections, which can be very stubborn to treat. And
I'm examining myself.
There are other telltale signs that if we see on the nails, we now think of, okay, you need to have a conversation with a kidney specialist. I cannot do anything at this point.
All right.
Right? And when it comes to skin, the biggest thing that I'm currently now dealing with is the aspect of bleaching. All right? And since I went into this practice, I've noticed it's like a significant concern.
Yeah.
May I ask?
Yeah.
What is bleaching?
So bleaching is basically the use of unquantified, unstandardized chemicals to try and depigment the skin. That's the easiest way I could put it. Why am I saying it's unstandardized or uncontrolled? It's because, number one, when these patients come into the clinic, they'll walk in with a bottle. Okay? When they walk in with a bottle, there's a machine which we do. It's called a dermoscope. We assess how the area of their concern looks like. And we're able to see signs of bleaching. And
so wait, this bottle they walked in with is just a water bottle?
No. There's a bottle that they have.
Ah.
You see the way you can have your sunscreen labeled company so and so, SPF 50 plus, content zinc, many other amount of ingredients within that bottle. The agents that they come with have one logo slapped. Glow your skin in 5 days, Nini. That's it. You have no ingredient label. You have no confirmation of what is inside. You have no instructions on how to apply. So this guarantees them the short-term
Benefits.
But why do they come to the clinic with a bottle?
They want us to. I push them to do it. Reason, case in point is, if you do not know what is going on your face, why do you apply it? Yes, I know you're chasing the
Beauty.
look. Yes, I know you're chasing the look, but you've now come with a condition, and you're using this.
So maybe you can let us know what conditions they usually come with. Is it their skin? Is it melting? Is it burnt? What are we seeing?
Okay, so number one is the intolerance to heat.
You know, this guy watches this movie called Zombie Apocalypse.
I need to understand what is going on. And I watch The Walking Dead also.
Okay, so the biggest concern is, number one, you have very soft, fragile skin where wakisimama tu nje kwa jua kidogo, they cannot tolerate the heat, so they're always inside. That's when they become red. 2 is appearance of acne. 3 is excess hair. Women coming in with sideburns, kidogo, even longer than yours.
So, as the pigment goes, you now
you get
develop facial hair.
Facial hair comes in. Acne can come in.
Dear.
You get redness. You get... If you consistently use this, the skin becomes persistently thin. And if you stop the products, you go back to square one, but 10 times worse.
Explain. I'm already dark. If I bleach and then I stop, what do I become?
Okay. So let's examine the contents which we mostly find in these bleaching creams. Number 1 is the hydroquinone. Number 2 is mercury. Number 3 is steroids. Okay. So if you're talking about hydroquinone will make them have an irritated skin or an itchy skin. Some of them can become allergic to it. The other thing is progressively it can cause liver damage and kidney issues, specifically the hydroquinone.
So this stuff is not something that they apply on their faces, they drink it.
No, they apply. They apply. But remember,
it's a cream.
It permeates the skin and gets into the bloodstream, so it ends up affecting the kidney.
Yes.
Oh.
So we move to the mercury aspect, and the mercury aspect and it is one of the least, I think, paid attention to when it comes to these products. Mercury works. You get your results. The combination between hydroquinone, mercury, lead in some cases,
Lead
and steroids, yes, you will find them in these products. So the combination
These
of
are
this
highly poisonous things.
Unashtuliwa na lead na mercury peke yake is lethal.
So we put you assess the side effects that first come in. Number 1 is someone is moody, sleep is disturbed, kidogo memory is out. That's when you now end up thinking, okay, what is inside this? When you look at it, unapata kuna mercury. Before, if they continue using it, guaranteed brain damage kicking in early. I've had.
So that means dementia and other things.
Yes, I've had 2 specific patients,
Yeah.
which really hurt me to some extent, and one of them is someone I've known for quite some time, for close to 5 years, around 26, 27, with heart failure. A lady has been on these creams for God since I knew her. And siku moja tu ile tumekaa chini, I just inquired, what do you apply? She showed me a picture. Looking at it is something called clobetasol. So clobetasol is a highly potent steroid.
Yeah.
So it gives you amazing results in terms of getting the depigmentation aspect. You've removed the pigment. But progressively, this clobetasol will alter how you produce cortisol.
Okay.
Because steroid and cortisol are basically the same group, right? I'm giving steroid to my skin on top. It will enter into my bloodstream. Once it enters into my bloodstream, the brain will understand this person has
enough
cortisol inside.
So cortisol is no longer being produced.
Cortisol is suppressed. Okay? So now that makes in the following to come. Number 1, it boosts up the following: the fat amount in your body. Number 2, the glucose control in your body becomes impaired. And number 3, the performance or the health of your bones becomes impaired. So now you find, from just a simple thing,
You're playing on your skin.
kupaka, you have got heart issues, you've got liver issues, depending on if you're talking about mercury, and kidney issues if it's mercury.
Yeah.
Hydroquinone burning the skin. There's some and even what's it called? And hydroquinone burning the skin.
Yeah.
Something simple that someone thinks itatoa hii siku tano, and you're okay, results in this. And the desperation comes in when mtu amesema okay, let me try and stop, but once they stop, the results are reversed.
So they want to continue.
So there's that persistent compulsion to go back into it,
Yeah.
while forgetting that kuna hii side ingine that is going affected.
Are those things addictive? It's just the psychology part of it.
Psychology part of it.
Okay, so it's not that necessarily you wake up with cold turkey and you're like, I need that cream. No. Okay. Now there's when who produces these things and how are they in the market? Is it something I can walk into a chemist or a beauty shop and buy?
Steroids are supposed to be controlled substances, right? But our nation being
Kenya,
it's something that you can, if you have the right connections,
yes.
Zapata.
But to be clear, it is not something I can just walk into a pharmacy and say, Niaje, give me that. You called it what? Cordobisol?
Hydroquinone.
There's one that you said that is very
Clobetasol.
potent. Clobetasol.
Yes.
So it's not something I can just walk into. It's not something I can just walk into a pharmacy today and say, give me clobetasol, and they give it to me.
No.
Okay. I need to have a prescription.
It has to be prescribed. Even in the field that we are in, there are, to some degree, some of the medications that we're talking about, the clobetasol, we can use it. The only difference between me and the connection between me and the patient is I am going to tell you, if you continue using this, we have this.
Yeah.
Versus the other side is
Shika. Leta pesa.
Yes.
See you next week.
Yeah.
Wow. Now, we have established that indeed these are poisonous substances.
Yeah.
The people giving it to patients and Kenyans, actually those are not patients, giving it to these people who are chasing after a certain kind of beauty.
Yeah.
Are they like licensed individuals, or they are just people acting in the black market?
I would say both. Reason is the licensed individuals would be positioned as cosmetic shops, and the unlicensed ones are those who will synthesize these products themselves from home. I don't know if you've been on TikTok, umeona someone is wearing gloves, ameshikilia basin, anamwaga some lotion.
I have actually seen that, yes.
And a slap, and he
mix,
mix.
Mkorogo,
Mkorogo.
I think.
So some of those are not licensed. The other thing is, to me as a customer, if I'm thinking from like a plain point of view with zero knowledge, why is it that mimi nakuja kununua kitu wewe umevalia gloves mix? Are you that scared of it?
Maybe tunadhani tu you just don't want to get yourself dirty. Not dirty. Yani utaki tu ile kujichafua.
Hypochondriacs.
The reason why people wear gloves in such situations is because they're protective.
Yeah.
So what are you protecting yourself from?
Right.
First question.
That's the biggest question that people should ask.
Yeah.
Yeah.
Aya. You see, we get a lot of information out here.
Yeah.
In regards to what is it called? Promiscuous behavior. We are told, condoms. We see adverts of condoms everywhere, kwa magazeti, kwa radio, kwa TV, adverts on YouTube and all that. Why don't we have these kinds of PSAs out there to just tell people, like, look, hizi mkorogo mnajipaka ndizo zitawaua?
And I think we're now trying to come up with that concept. We're partnering as Loving Lab Coat. We're partnering with Radio Generation and a number of other stakeholders to try and push this message. Because if I was to give you a statistic, 1 among 8 women wanatumia. All right? Among that 1, potentially kidney issues will come in. That's a cost to the government for matibabu. And heart issues will come in, another cost of treatment. Infections, these medications will suppress your immune system significantly. So persistently, every other month, mara mbili uko hospitali. Unatibiwa either pneumonia or intestinal issues, constipation, stuff like that.
Yeah.
So I think the reason why I am pushing for this is, number 1, in terms of the necessary bodies who are in charge of regulating the pharmacies, we need to have a clear understanding of where do these people who mix these things get it from. 2, because you already know that the content is heavy metals and steroids inside. We need that stopped. Yes, you can. They market it as solutions for medical conditions. Why treat medical conditions with unstandardized content within those creams? 2, unregulated dosages of the hydroquinone. The allowed percentage that is flying in the market right now is 2% of hydroquinone. But in such concentrations, you can find it's more than 4.
Doc, let me ask you, because you've used those two words again that you used earlier on, unstandardized and regulated.
Yep.
Is there a standardized and or regulated way of skin whitening?
There is a controlled way
that you can still achieve the results as a patient or as a person who's looking to look whiter. Why you want to do that, I don't know. But is there a way that is safe at the end of the day that won't lead to the kidney failures and the liver failures and all the other failures?
There is a controlled way, and the catch comes in between the conversation with your doctors. All right? And the reason why you're doing it.
Yes. Maybe I just don't want to look like Siti Muga anymore. And by Siti, I mean people with his skin color.
Sasa, if the motivation is you naturally denying the complexion of your skin, then it becomes a psychological and a psychiatric issue that we have to address it from there first.
Okay.
Not as a
Doctor.
Skin specialist or doctor, aesthetic doctor.
Okay.
We now work with the psychologists here because we need to identify what is causing you not to embrace your skin type.
Yeah.
2, if you're now talking about medical conditions, the vast majority that exists, we now have set a plan. We know what to use. We monitor your labs, and then we find a date where you're going to stop and maintain you on the results that you have.
So I have gone to Mathare, nimeongeleshwa na psychologists wote wameniambia, yo bro, you're handsome the way you are, your skin is perfect, da da da. And I'm like, thank you so much, doctor, but I still want to be white. So can we get over with this? So there's a way now, after I'm done with Mathare, I can now come and have a seat, nipatue all the safe creams, all the nice things that I need. I look white and life goes on.
Why do you want to go into all this bother and all this expense?
I'm just because there are some people who actually they're like, I really it's not like I hate black people. I just want to be white. That's it.
I've understood that bit.
Yeah.
There's a very famous person who did that and even changed his nose, which kept falling off from time to time.
Actually, that person was sick, but yeah.
But that's precisely my point.
Yes. He was sick, right?
Yeah.
Yeah. It was a legit medical.
Vitiligo,
Yeah.
And the doctor exactly has been alluding to that throughout. What is this problem that you have that makes you want to change so much that is naturally you?
I don't know. I'm just asking. Me sina shida na mimi.
You do have a problem.
Me sina shida.
But that's the thing.
Yeah.
You're denying you don't have a problem.
Yeah.
And yet you do. Because
Are we talking about me?
No. The you is the third person.
Oh, you're talking about that patient.
Yes, not you.
Okay.
Not you.
Because I was now going into defensive mode.
No, don't.
Ningezima microphone tuongee kando.
No, it's not that.
But yeah, but there are individuals who is it really a psychological problem? It's because maybe I just don't want to be
That's the problem.
Yeah.
What is the problem?
Here's the thing. And such patients are basically, I'm not a psychologist,
Yes.
but
from what you have studied.
From the patients that we see, you notice that there's a persistent obsession into the flaw that they always have. And that persistent obsession will now lead to a compulsion. The compulsion is you now coming to tell me, daktari, mimi nataka ngozi yangu ifanye hivi.
Yeah.
Until I have found the reason as to why your obsession is there. That's the only time I can treat you.
Because you see, if I come to a legit doctor like yourself, and then I want to whiten my skin, this time I've taken away the bleaching, because the bleaching is the unstandardized one, the unregulated one. Right. So this one is just me wanting to be more whiter, right? Or lighter skinned. So I've come here, I want to have a pale skin. And I talk to you and I'm like, doc, here's 1 million down payment. Can we start this process? And I'm like, no, it's in movie. We talk, you introduce me to a psychologist called Dr. Muga. Dr. Muga comes and tries to talk to me and I'm like, Doctor, you know what? But I mean, niko tu sawa. I just want fair skin.
There are safer options.
Yeah, so because you see, if I come to you and I've given you the money and you don't want, now nitenda River Road, find a herbalist, who's wearing all those very long gloves, mixing the heavy metals. And guess what? For I don't know how much money they charge, but I'm sure it's very cheap.
But the doctor isn't just going to tell you no. No. Doctors examine. If it's outside their scope of expertise, they will refer you.
Yes, they will.
To somebody who will be able to perhaps deal with the problem. You can't say you want to change the way you are and then in the same breath say you don't have a problem. You do have a problem. It's very different if you break your leg and you want to put some prosthesis or you want something. That's different.
Yeah.
Context. Yeah.
Yes. But
it's the same way as dyeing my hair. There's a time actually I dyed my hair, I think it was blonde. At that time I did blue, I did red, I did my beard as well. I didn't have a problem.
Of course you did.
I just
You just didn't know it.
I was just experimenting.
If it was such a good thing, why didn't you just retain it so that now you'd have purple and blonde?
I outgrew it. As there's no way ningefanya kazi radio generation with blue hair. Hata wewe si tu ungesema I can't work with that fellow.
No. I'd happily work with you if you had blue hair.
Blue hair?
Yes, I've watched the movie Avatar, so I know. Even if you came here,
now lazima mdai nywele.
Monday we come with blue hair, sir.
Not we. Yeah, I'm okay the way I am.
Look, coming here with blue hair on Monday.
Look, every time I go to the same barber. Now I have 3 different barbers, but they've stopped asking this question because every time I would go there, they'd want to color my hair, and I'd say no. I had to explain to each of these 3 at some point and said, look, let me explain to you. I want this hair to follow the natural course that it's supposed to take. I don't want any interference. I don't need coloring. I understand what you're trying to do. Because they'd say, but you know your friend so-and-so does this. I said, yeah, that's them. Your friend so-and-so, in fact, comes here this regularly for this. I said, that's them.
True.
The moment you have this visceral need to do something that drastic, believe me, something is not quite there, because it is a very serious form of attention-seeking behavior. It's like you are seeking to be more acceptable. In whose eyes? And for what reason?
I mean, I agree with you, and I don't know. Is there someone out there who just wants to do things not because he's looking for or she's looking for validation? They're just doing it because they want to do it. Toboa Maskio because I want to do it. Toboa Mapua because I want to do it. I'm not doing it because that also now.
Everything we do, if it isn't a knee-jerk reaction, is for a very good. Even that knee-jerk reaction can be explained logically. There is a reason. There's always a reason.
Okay.
We're human beings.
It's basically a form of OCD.
Yeah.
So you have this persistent thought in your brain that I have to look like this, I have to look like this, I have to look like this. And you now act on it. And you acting on it can be a mask for something significant going on within your psyche and your brain.
Okay.
Yeah. So majority of the time, yes, you can look at that mild relief that you would get from doing whatever it is that you wanted to do, but in real sense, it's not going to go away.
Doc, there are some people who bleach, but their knuckles never bleach. Is that?
It's basically the same thing that is used on the face. That's applied there.
Yeah.
Yeah.
Hey, issues.
Yeah.
Are there any other conditions we need to know as far as any other side effects of bleaching? I know you've mentioned especially the critical ones, but is it reversible?
Yes. How you stop it is also important.
Yeah.
And case in point, if let's say we've been on these creams, I cannot tell you wachana nayo mara moja. All right. Reason is, if the content is steroids, remember your body was already having persistent supply of that steroid, telling your brain that you have sufficient cortisol, telling your adrenal glands you do not have to produce more cortisol. So the body is now reliant on you to give it its
Cortisol.
So that immediate stop will hit you with rebound effects. The rebound effect is hypotension. That's basically steroid withdrawal syndrome. Hypotension, nausea, dizziness, vomiting, high BP occasionally. So you find that you having chosen to stop this is going to put you back in the hospital now for medical treatment. The trick in stopping these agents is, if you want to stop, first of all, contact two people, psychologist, psychiatrist, and a skin specialist.
Okay.
Second, make a plan with your skin specialists on how you're going to phase it off.
Yeah.
What other additional substances or medications can we use to rehabilitate your skin to go back to where it was? And the biggest point of pain that I feel from my patients is the fact that patience is kidogo sana. Very little. Why do I say this? Is you are very light skinned at that time. I am telling you, we will go back to dark skin. And we will have to wait. Let your skin heal, please. That period of time between allowing the skin to heal and going back to now trying to sort out the pigment disorders that come in is something that majority of patients can't wait. Yes. And now the obsession or the addiction per se goes back. So everyone is still going back to the same agent.
Yeah.
Hey.
Okay. There's a patient, there's a viewer asking, this is Eunice Kyoko asking, where can we find this great doctor? I know one or two people who needed intervention on matters skin madhogodhanio.
Okay. Currently have my practice just hapa Kilimani. It's called Damal Healthcare.
Damal.
Damal, yes. Damal Healthcare, that's where you'll always find me. Yep.
Is there a number we can call maybe, or a website we can check out? Maybe
Yes.
social media pages we can also see?
Still the same, Damal Healthcare on IG, on TikTok. Damalhealthcare.com as our website. And if the contact info would be 0758 273 348.
Yeah.
Yep.
Just one more time, please.
0758 273 348.
We si tutaonana kando after hii show, niambie venye tuta sort hizi vitu ziko hapa hivi. Actually, I thought it was just my skin, and I never thought that something I can get rid of. I've seen a lot of my relatives having it, so I thought it's a genetic thing. Kumbe it's something I can actually get rid of it completely.
Yeah.
Nikae kama ule receptionist hapo nje.
Why do you want to get rid of it?
Kama I can get rid of it, why not?
No, my question was not combative.
Yeah.
I was just merely asking, humbly, why would you want to get rid of it? Have I changed my tone sufficiently to show that I'm just inquiring?
Yeah.
Yes.
Yeah, but that inquiry is very intimidating.
Okay, why do you want to get rid of it?
Let me tell you after as we go on a break. Thank you so much, Dr. Muhyidin Mohamed. That is Dr. Muhyidin Mohamed, aesthetics and rejuvenative medicine specialist. If you've had those contacts, just let us know. You can DM us